but the problems are not hers. But fortunately, she's been able to help us proceed.
Well, I think you have a good point, and with the Hurricane Ian being
Right.
impacting many parts of the state of the country, that it may also impact us in ways that we
Right.
weren't expecting. So our thoughts are certainly with those who have bigger issues than we do today.
Right. Exactly. Okay. In the essence of time, I am going to begin. I want to thank you all for joining, and please don't be surprised if people are beeping in as we proceed. I am delighted that this year we are, with our marketplace update training, we do have our state-based marketplace that has been in existence for a year and continues going gangbusters and with reduced premiums. So I really look forward to hearing all the new information. And for all of those SHIP counselors, please be aware, we do this every year. The expectation is not that you become experts on the marketplace, but rather that you have a basic understanding and know where to refer people for help with the marketplace, because we are awash with experts here in the state. We do expect you reciprocally to be the Medicare experts. So all these navigators and certified application counselors, as they're helping people, do run into consumers who are aging into Medicare, have family plans with people who aren't aging into Medicare and have all sorts of needs. So they will refer the Medicare issues to you, and please don't hesitate to refer the marketplace district to them. You will be receiving all the appropriate referral information. So today we are going to begin with a recap of last year and information about this year's marketplace from Consumers for Affordable Healthcare, Mary Michaud. Then we'll move on to the role of the navigators with Western Maine's Community Action Zone, Patty Lovell. And then the role of the FQHCs through Maine Primary Care Association, and we'll have some value information from them. And then Joe Stone from CMS is going to do the marketplace and Medicare presentation. And today we're very lucky to have Everett Hanford, who has just joined as our HHS regional regional director for Region 1. And Region 1, Maine is part of Region 1, along with Massachusetts, Rhode Island, Connecticut, New Hampshire, and Vermont. And I'm just going to, Joe Stone gave me a little bio that I'm going to read. I usually don't like reading from a script, but I was so impressed, Everett. I don't want to miss anything, so I want to read your bio. Everett joins HHS from the Commonwealth of Massachusetts. He previously served as the Deputy State Director for United States Senator Elizabeth Warren, who's a Democrat from Massachusetts. Everett oversaw Senator Warren's state operations, constituent services portfolio, and political outreach. No small job there. Prior to working for Senator Elizabeth Warren, Everett was a brand management consultant for professional athletes. Everett received his master's degree from the University of Southwest in Hobbs, New Mexico, in public health administration, a business certificate from Northeastern University in Boston, and a BA of science from Johnson & Wales University in Providence. So he's a very diverse, well-rounded guy, and just wanted to say a few words to all of you today. So welcome, Everett. Thank you for joining us.
No, thank you, Ann, and good afternoon, everyone. I certainly bring you greetings from the regional office of the U.S. Department of Health and Human Services here in New England. And I just wanted to come on and thank all of the staff, the volunteers, as well as the Maine State Health Assistance Program for attending today's AAA Marketplace training. And certainly for your sincere interest and willingness to at the end of the day, support and educate and counsel Medicare beneficiaries throughout the open enrollment period. You know, as you all know, today's training provides an opportunity for those individuals who work with Medicare beneficiaries, caregivers, and families to give the appropriate information available in order to make the best informed decisions about their respective care and benefits. As you know, families, they touch many of our systems. We all need an all hands on deck approach to reach those looking to receive the care that they deserve. And certainly with your help, you know, the state of Maine and their Medicare population, both current and newly enrolling beneficiaries will be assisted in their Medicare coverage for 2023. So I look forward to a robust discussion and training with you all this afternoon. And on behalf of the U.S. Department of Health and Human Services and Secretary Javier Becerra, thank you.
Thank you, Everett, for joining us. I'm now going to turn things over to Mary Michaud from Consumers for Affordable Healthcare. Take it away, Mary.
Thank you. Good afternoon. I'm Mary Michaud. I'm the Consumer Health Engagement Specialist and Helpline Advocate for Consumers for Affordable Healthcare. I'm going to share my screen and go through a few slides of what's going on. So, let's see. Okay, so marketplace updates today. So the mission at Consumers for Affordable Healthcare is to advocate for the right to quality, affordable healthcare for every person in Maine. We are a small organization out of Augusta, Maine. We operate a health insurance consumer assistance program that gives you the toll-free helpline. We screen for eligibility for marketplace and main care and do the enrollment help and slash problems that you may have with your applications to the marketplace. We also do private insurance appeal assistance. Our consumer assistance services for professionals is as well the toll-free helpline, workshops and trainings, which you're here today, the assister listserv, which many of you are on that listserv for information as we get it. And then, of course, our appeals assistance for professionals. The policy and advocacy work that we do is the public policy research, legislative advocacy, administrative advocacy, and of course, our weekly newsletter that we send out to the listserv. So the agenda for this afternoon is the marketplace basics, looking back on open enrollment for 2022 and looking ahead to open enrollment 2023, and then a brief overview of Maine Care. So Maine is this new state-based exchange, and we all experienced that in the last year. So it went considerably well, had some glitches, but they're all being worked out. The website that we use is coverme.gov, and our recommendation as a group is for consumers to use the shopping tool anytime that they're wanting to, look at the marketplace without having an application involved. They can do that shopping tool and get some good information before they actually pick a plan. The call center is available, and that is the 866-636-0355, and that is to troubleshoot if a person has an application issue. The coverage periods for 2022, all marketplace plans will end December 31st, 2022. The coverage periods for 23, we will have an open enrollment beginning November 1st, 2022, with the last date to enroll in a marketplace plan, January 15th, 2023. Please keep in mind that the enrollment period for coverage January 1st would be November 1st to December 15th. Anything after December 15th rolls to February 1st. So please keep that in mind. Can anyone buy off the marketplace? Well, yes, unless you're incarcerated. If you have you're eligible for Medicare Part A, and the folks that, I'm sorry, that's in my way, but people that are not legally present. Those are the three instances where they cannot shop the marketplace. The marketplace offers 3 plan levels. And as you well know, it's the bronze, silver, and gold are the most popular. Bronze being the lowest premiums with the highest out-of-pocket costs. The silver being the mid-range premiums, and they have the lower deductibles and out-of-pocket maximums. And they also offer the cost sharing reduction, which is that co-insurance piece that is involved. And of course, the gold is the gold. It's a higher premium, but also it has even lower deductibles and out-of-pocket costs. Marketplace plans, as you well know, have 10 essential benefits. Preventative care under these plans, for all plans, you have an annual physical that can be done each year, immunizations, and screenings. Screenings, it's important to remember that just a screening. Once it becomes diagnostic, it goes to the major medical part of the insurance. So just keep that in mind. But I won't read through these 10 essentials because we've all kind of memorized them, I think, but they will be available in the slide deck. The insurers for the state of Maine have been and will be Anthem, Harvard Pilgrim, and Maine Community Health Options. They all offer the bronze, silver, and gold plans, and they all use provider networks and drug lists. The new insurer for this year is Taro, and it works with a direct primary care provider only in Cumberland County for this year. So the residents in that county will be able to shop this marketplace and choose the Taro plan. So the Taro plan is direct primary care, which means that you pay an annual membership fee, and they also have monthly fees to the physician. So the patient can see the physician as many times as necessary, and the visits can last as long as needed. So that's kind of the perks to that plan. The annual membership part of that will be paid by Taro, and the monthly fees to the enrollees direct primary care provider. Taro plans available in all metal levels and will have out-of-pocket costs similar to other available plans through coverme.gov. And their plan is also a network with Maine Health for specialty care. What are advanced premium tax credits? They are the amount of money that everyone the person gets to lower the cost of the monthly premium. They're available for all plans in the marketplace. The APTCs are based on the applicant's 2023 income estimate. So keeping in mind that you're always projecting income when you're dealing with the marketplace, so people have to be aware of what they're going to make and make changes as that changes, basically. The cost sharing reductions, once again, are the extra savings that I talked about, where it's going to lower the out-of-pocket maximum for those that are eligible. And it's only in the silver plans that is part of. And then the eligibility for cost sharing reductions is based on the income between 138% and 250% federal poverty level. This is a graph of the eligibility chart for subsidies for 2023, starting from a household of 1 through the household of 4. And that will also be available in this slide deck. Just keep in mind that the cliff, as we used to know it, the income over 400% federal poverty level is a person pays no more than 8.5% of their total income towards their premiums. So in essence, everyone gets some sort of reduction in their monthly premium costs. So like an oil check, we like to say this, annual maintenance is required. And so here at CAIG, we advise everyone to go into their marketplace account and update it. We know last year that there were several problems with re-enrollments from the insurance companies. They did auto re-enrolls, but they did not follow with the premium tax credits. So we got calls from individuals who were $500 a month, $700 a month, and they didn't understand. Well, if you don't go in and do that oil check, then you're not updating your premium tax credit. So it's very important that people, do their account every single year. And that way if they have to take a member out of their household, or they have another member, or, all those changes can be made once a year. And it's very important for people to authorize the marketplace to get the updated tax information from the IRS so that data matching can be done correctly, and that you're ensure that you're enrolled in the plan that's right for you. That is a big thing. And that's why we always suggest that people use the shopping tool prior to doing their application. Special enrollment periods, as you all probably have worked with one person or not. Special enrollment periods are outside of open enrollment. And so there's always specific criteria with that. The application must be submitted no later than 60 days following an event, or in some cases, the application can be submitted 60 days prior to the qualifying event, only if you know it's going to happen. And the next slide is the list of special enrollment periods that are considered for marketplace. And what does not trigger an SEP? Voluntary dropping their insurance and termination for a lack of payment. We have dealt with both of those. Marriage, unless one spouse had coverage prior to the wedding, and then divorces unless there is a loss of coverage as a result. So those are the ones that do not trigger the special enrollment period. So keep in mind that documents may be required, and submit the required documentation after plan selection. We always suggest that people do those items as soon as they can, so that they're not putting it off. And then sending people to an experienced main enrollment assister for help with SEPs is not required, but it's definitely something that can help them do the process a little bit faster, because it is confusing. So looking back on 2022, open enrollment was they served total enrollments were 66,095, which was an increase of 11,025 enrollments from 2021, which is nearly 14% increase. That's great news. And then the new high for marketplace selection since Maine Care expanded for consumers with income between 100% and 138 federal poverty level. Open enrollment ran from November 1st, 2021 through January 15th, 2022, and which provided Mainers additional time to enroll. Looking ahead at 23. So we're all waiting for the changes to the family glitch. We're very happy about the enhanced APTCs through 2025. That means that all these folks will continue to get the lower premium costs based on their income, of course. And then the changes in the family glitch, we're all holding our breath, hoping that that really is something that we're going to celebrate at the first of the year, because it'll take away that, well, it'll make that situation better for families in Maine that are getting employer offer of coverage, but the family coverage is so expensive that it keeps them from really being able to shop the marketplace. And then, of course, in 2023, the changes in Cup Care are going to be phenomenal as well, because it's increasing the limit, the income limit, to 300% federal poverty level, which is roughly, this math was $6,900 per month with a limit for a family of 4. So that's going to let them have no more premiums and no more 3-month uninsured waiting period for children with workplace coverage through parents. So those two things will be taken away from the Cup Care part of Maine Care. Marketplace in Maine, 2023 enrollments will be completed using coverme.gov website, which is operated by the Office of the Health Insurance Marketplace in DHHS. And Maine Enrollment Assisters, that's the new name for the certified application counselors and navigators that previously was the title. So Maine Care information. What is Maine Care? We all know it's the state-based Medicaid system. Eligibility is based on income. It has no deductibles, no or very low copays, no or low premiums, which that's going to change to no premiums. And it's a comprehensive coverage for children and adults, to include dental now. And so many providers in the state of Maine accept Maine Care, but the member really needs to check and make sure. The Marketplace versus Maine Care. Marketplace pre-screens and submit your applications. So be sure to open all mail and submit required information by deadline. That's so important. People eligible for Medicare or Maine Care are not eligible for Marketplace subsidies to lower the cost of health plans. You can't have Marketplace and Medicare or Marketplace and Maine Care coverage at the same time. So just keep in mind that people need to be reminded that if they hop onto Medicare, if they've reached that age, that they need to get, they need to cancel their Marketplace plans, as well as Maine Care coverage. So the federal public health emergency, which is now in effect, most Maine Care members are not being closed out or terminated during the federal state of emergency. The only exceptions are the list here, which are the person who is deceased, person is no longer a Maine resident, or a person that voluntarily withdraws. Cub Care child ages out of Cub Care. So, and then the person is not validly enrolled. So, and that's basically if they were enrolled due to an agency error. And then, so right now, DHS, there's a lot going on because they're getting ready for the end of the public health emergency. But some really important things to keep in mind and tell your consumers is to make sure if they have any changes in their contact information, to let the Department of Human Services know. It's very, very important because they're going to be sending communication out to these folks, and they want to make sure that they have the current contact information. People need to be, main care recipients need to be watching their mail, watching the messages off My Main Connection, and responding as soon as they get those messages. So really just keeping that on the forefront for main care recipients, to always let departments know what's going on in their family. Those no longer eligible for main care may qualify for low-cost health insurance at coverme.gov. So that's going to be the transition for people who are over income coming off main care when the federal emergency is lifted. They're going to be able to have that special enrollment period to the marketplace. Changes to main care, as we some of them we've mentioned, but postpartum coverage now extends up to 12 months. For immigrants, it will apply to non-citizens legally admitted to the United States and otherwise eligible for main care. Main care is available for income eligible Mainers regardless of their immigration status if they are pregnant and under 21 years old. And then, of course, the dental coverage was added, and that's the complete coverage, preventative, diagnostic, and restorative care. Right now in the state of Maine, there are limited dentists that are taking main care, and the recommendation is to get folks on wait lists and have them keep contacting providers to see when they'll be taking main care recipients. And there's going to be further discussion about that later on today. But and then cup care, I'll mention again, is that income limit increases to 300% with no premiums and no wait periods. The marketplace may cancel a person's APTC if they're eligible for main care or Medicare and will terminate the marketplace plan. Well, the marketplace will cancel APTCs if you have main care and Medicare. But once again, it is the person's responsibility that if they receive Medicare or main care, they need to terminate their marketplace plan. They do not want to pay money back. If signing up for marketplace coverage as a couple and one becomes eligible for Medicare, then making sure to create that marketplace application in the younger person's name instead of the person turning 65. And again, just reiterating that if you have those main care Medicare, you need to cancel your marketplace plan. Can't repeat that enough because we've fixed a lot of things in the last year to do with that. So early retirements have been bumped up. So it's really important to keep communicating to people. And then we do have a list of resources that follow. I won't read through all of those for time's sake, but they will be included in this slide deck. And I'll just go through those. And thank you for attending today. And I believe questions are going to be after the presentation. Thank you.
Thank you, Mary. Welcome, Patty.
Hi, thank you. So I am going to share my screen and can everyone see that? Can I have a yes?
Yes.
Thank you. So Navigators worked under a federal grant. Now that we are state-based, we are now all called Maine Enrollment Assisters. but navigators still exist under the state grant, and we have a higher level of requirements for us to provide services. And so I can let you know what those are as we go through. And a Maine enrollment assister, we have to maintain our expertise and conduct public outreach and education. We distribute fair, accurate, and impartial information on options available through health insurance. We help people enroll in the qualified health plans on the marketplace. We make referrals to appropriate programs and agencies such as the AAAs, because we do not do Medicare. I know enough to know that I don't want to know anything about it. I know it's very complicated, and you guys are the experts, and we refer to you guys, as we encourage you guys to refer to us for marketplace or main care concerns or questions. We provide information and services that is culturally and linguistically appropriate, and that is required of navigators still. And we have to be accessible to people with disabilities. So we have to have services available if someone is hearing impaired, sight impaired, physically impaired, or need other accommodations to meet their needs. And we assist with appeals. So if someone has been denied or someone is struggling with some part of their health insurance, we support them, including referrals to the Bureau of Insurance for the state of Maine. So we are into the second upcoming year of the state-based marketplace. This is exciting. We receive state funding through the Department of Health and Human Services, now the health insurance marketplace. In 2023, open enrollment will be the second year that we have been on a state platform versus the federal platform. And the Western Maine Community Action Healthcare Navigator Consortium consists of 9 nonprofits conducting outreach, education, and enrollment assistance in all 16 counties in Maine. We are not physically located in 2 counties, but we do referrals to other Maine enrollment assisters in those counties, or I have actually had volunteers in those communities or have met people in communities. And because of virtual enrollment, I can support people throughout the state of Maine if I cannot find someone within that community to meet them face to face. Our focus is during open enrollment assistance through in-person and remote assistance. And then we do more phone-based assistance during after open enrollment, just because the enrollment assisters in the other organizations do not do it full-time. And so during post-open enrollment, they do other things as well. But we are available in all communities to help everyone that we request assistance. So the consortium for 2023, again, navigators will be available in all participating agencies for in-person meetings and remote access. We also do not only Zoom enrollments, but we also do 3-way calls with Marketplace. And individuals can be referred to a specific agency within their community. And again, when we talk about that remote access, it can be anywhere within the state of Maine that someone is supported. Post-enrollment, consumers will be directed to the statewide navigator helpline first. And if that cannot be resolved, then we'll make a referral to someone within their community to help them in person. And the direct line for the navigator helpline is 1-855-806-7333. And this is a list of the navigators throughout the state and the agencies with their telephone numbers. This will be on the slides that you guys receive. And if anybody wants this individually, I can send that to them as well. So for statewide coverage, There are 5 community action agencies and 4 nonprofits that provide statewide coverage. We collaborate with other Maine enrollment assisters to provide coverage throughout the state. And we provide in-person and remote assistance. A lot of 3-way calls I do in regards to terminating coverage because they're going on to Medicare. It takes about 10 minutes to do it. Once you call the marketplace, it's basically a 10-minute phone call. It's not too painful, but making sure that gets done so they don't have both Medicare and Maine Care coverage is very important. So for local details, we provide enrollment assistance. I provide enrollment assistance in Franklin, Androscoggin, and Oxford counties. I physically work out of the East Wilton office and the Auburn Wick office, but I also have a volunteer in the Bridgeton area. And again, I can be reached at either number for appointments or any assistance. So in regards to outreach strategies, we work within our community action agencies to do what we call in-reach or referrals between departments within our agencies. So if someone is applying for fuel assistance and they complete a survey at the end of their appointment and it indicates that they don't have health insurance, they're offered my information and are asked if they would like a call from me. So we do a lot of cross-referencing within our agencies. So grassroots outreach and education, we work with each other in regards to events that are coming up and working to educate people in the community about information that we have, services that we have. We just recently did the Farmington Fair. I also have another outreach event on Monday with our local health community coordinators. So we'll be working with other agencies as well as our own events to provide education and outreach. We work with the area media. We have radio stations that we work with, as well as newspapers, and getting information out about what we do and who we are. We will conduct educational outreach and training for consumers and organizations, and you're more than welcome to give me a call if there's something that you would like for me to attend or someone from your community to attend. And enrollment assistance availability for state-based marketplace, coverme.gov, and Maine Care applications. So we support people in not only the marketplace, but also for Maine Care applications. So for an appointment with a Maine enrollment assister, some of the things to bring are the names, addresses, date of birth, and social security numbers for all family members. Coverme.gov, username and password for re-enrollment. Income documentation. Some people bring pay stubs. Some people bring last year's tax returns. Some people bring everything, including bank statements. So whatever that person needs to bring in with them so that we have accurate information in regards to their income. Information about other coverage. So if you're retiring and you're being offered COBRA, have them bring that with them as well, because we want to be sure that they're getting the best coverage that they can, as well as looking at all options available. And not only that, but we want to make sure that if they're offered other coverage through their employer while they're still employed, that they're not, their employer is offering a health plan that qualifies them for marketplace health insurance. There are different qualifiers. So if it's not a quality health plan that meets certain criteria, then they would qualify for the marketplace. And any immigration document numbers. Some people just bring me their card, their green card, and I can get the numbers from that. That's really the best. And optionally a credit card, so we can make that first binding payment so that we're the person can be sure that the payment is made and that they will have health insurance starting the beginning of the next month that it's appropriate. We also go through privacy standards. We provide impartial advice, and there is a time commitment. An average new enrollment can take 1 to 2 hours, depending on what we're doing. If we're looking at plans, we're doing a complete application. And how the AAAs can support the Navigator program. So share information about us, what we do during outreach and educational events, have informational materials available for your consumers who could benefit from Navigator services, and refer them to volunteer navigators or to us, and we can refer them out. Excuse me. And also we, in turn, again, will refer people with Medicare questions to the AAAs. If you have any questions or want to reach out to me, my name and contact information is listed here.
Thank you very much, Patty. An invaluable resource.
And let me stop sharing. All right.
Okay, and we are now going to move on to the role of the federally qualified health centers and Beth Pierce. And Stephen, if you wouldn't mind stopping your video, that'd be great. Thank you, Steve. And I apologize for the technical difficulties that we've been having today.
I think it's in the air and all understandable. Okay, so my name is Beth Pierce. My primary role is the oral health program manager, but I also handle the outreach enrollment support at the federally qualified health centers. So following up on Patty's presentation, I'd like to tell you a little bit about healthcare coverage and access to Maine at federally qualified health centers, or as we commonly refer to them, FQHCs. Next slide. Basically, who we are here at the Primary Care Association. We are a membership organization that represents the collective voices of the Maine's community health centers, which provide high quality primary care, preventative medical, behavioral health, and dental services for 1 in 6 Mainers. We have provided technical assistance and housed relevant programs to the FQHCs for 35,000, maybe it just felt like it, 35 years to hundreds of thousands of patients. We also work to strengthen Maine's health centers with programs and services such as clinical quality improvement initiatives, workforce development, community outreach, health information technologies, risk management planning, strategic planning, and technical assistance. We also work to amplify messages shared among member health centers, bridge medical practices and public health sectors, and provide linkages to community, state, and federal partners, including public health and allied agencies. What's on the screen before you is a map of where our health centers are. As you can see by the variety of dots, we cover the entire state of Maine, all the way south to North Berwick, to the east, in Eastport, far west in Rangeley, and all the way up north near the Canadian border and Fort Kent in Madawaska. And if you're looking to find a location that is near you, you can simply use findmyhealthcenter.org, and that will direct you to one in your location. If you look closely, you'll see that there are multiple dots of the same colors, and that indicates that that is one health center with multiple locations. Okay, so a little bit about FQHCs, or FQHC 101. As I said, the FQHC stands for Federally Qualified Health Centers, and they're also known as community health centers. All 3 terms are often used interchangeably. So they are federally funded, community-run, and nonprofit primary care practices. They're in areas designated to be medically underserved areas, serving as a medically underserved population according to HRSA. And we seek to improve the quality and access to care. We serve everyone in the service area, regardless of their insurance status or level of income. FQHCs in Maine served over 211,000 patients in 2019, or as I said earlier, about 1 in 6 Mainers. Approximately 20% of the FQHC patients are Medicare beneficiaries. And the services that are offered at FQHCs are comprehensive primary care, which includes behavioral, dental, and other specialties as available at various centers. And for today's purposes, enabling services such as prescription drug assistance, enrollment support so in main care, LIHEAP, SNAP, and other social services, and transportation service linkages. So my other role here at the PCA is outreach and enrollment. We have main enrollment assisters or MEAs on staff at most all of the health centers. MEAs perform in-reach, meaning when a patient comes into the practice and has a need identified, community outreach, and enrollment support. They're able to assist anyone with enrollment, whether they are a health center patient or not. They perform eligibility screening, consumer referrals, and enrollment, and they are culturally and linguistically appropriate in their outreach. And they uphold the marketplace privacy and security standards. So partnership opportunities, certainly like today, working with the group of people that are here. We also provide referral support. FQHC staff can assist with connections to healthcare or enabling services, access to primary care, specialty care, prescription drug assistance program, transportation, and other supports as needed or available. And that's typically either at their centers or where they would refer patients if they don't happen to have that service at their center. They can also fill a gap if you're working with someone who's in between insurance coverage and has healthcare needs, because they do offer sliding fee discounts in addition to accepting commercial insurance and main care and Medicare. So where would you go for help? Once again, if you want to find a local FQHC, there is the address below, www.findmyhealthcenter.org. Of course, you can always contact Consumers for Affordable Healthcare at their helpline at 1-800-965-7476, and at our new state marketplace website, coverme.gov. And I think that concludes what I have. I don't believe I put my contact information on the slides, but I will put that in the chat box if anyone does need to reach me.
Great. Thank you very, very much, Beth. And then now I'm going to turn things over to Joe Stone. He is our contact for CMS in the Boston Regional Office and has graciously offered to do the presentation today. Welcome, Joe.
Thank you, Ann. I'm gonna hopefully multitask here and get my presentation up and actually share it properly.
Well, you can run your own show, so thank you.
I love running my own show. I will say before as I load this, well, you know what? I won't multitask. Let me get this up and running and hold on a second.
Stephen, would you mind stopping your video? Thank you.
I'm hopeful that you can all see a full screen of my first slide. Is that correct?
Correct.
That's awesome. I can't say that it always works that day. I just dropped off a call with 5,000 people. We had our CMS awards program. And if it's any consolation for the technical difficulties that you had today, we too had many technical difficulties and dropped off and lost people. So it's not exclusive to Maine today. I do have two housekeeping things to say before I start. There's sort of apologies first for anyone that thinks as I'm coughing through my presentation that I have a cold or COVID or any such thing. One of the great experiences as I grow older is acquiring new allergies, and apparently I'm allergic to ragweed now. So I'm going to apologize in advance for, I've got my cough drops at the ready. Second apology is that Thursdays are my neighbor's day to have their lawn care company come. And I'm hopeful that that doesn't drown me out in any way. One of the joys of working at home. Anyways, I'm really quite happy to be here. And I'm glad I came on a little early and I had the opportunity to listen to Patty Lavelle and Mary Michaud. They touched on a couple of important things that I'm going to be redundant about, mostly about penalties. And I was happy to hear them hitting that point home about individuals who don't sign up for Medicare. That's really something that I can't talk about enough. Anyways, this afternoon, as my slide notes, I'll be talking about marketplace to Medicare, what you can expect. And one of the things that Patty or Mary, I can't remember which one we're talking about the experts, probably Patty at Cake. I am not an expert, so if there's something that I say that you feel is incorrect or I've misstated it, please, when we get to the questions and answers period, please let me know and we'll correct it. Always takes a village to do that. One of the things about the presentation that you'll see, this is from our national training program presentation that took place just a few weeks ago, I believe at the end of August. There's a number of slides in here that talk about Medicare enrollment and eligibility information, so generic Medicare enrollment and eligibility information. And I know that most of you, or probably all of you, are quite familiar with that, probably more familiar than I am with it. So I am going to move through that quickly. If there's something that I move too quickly through, please get me at the end. And actually, if you want a refresher on any of that, you can certainly go to the CMS website, the National Training Program homepage. And there's a deck there called Getting Started with Medicare, and you can always go there. First thing, it was interesting hearing Patty and Mary talk. It's hard to believe that it's been 13 years since we started open enrollment in the marketplace. Seeing the map of the FQHCs, it reminded me of all the places that we visited, from Fort Kent to Machias. I actually missed traveling around Maine. It was really quite enjoyable. And as was mentioned, this is now the second year that's Maine's running its own marketplace. I just read last week that Maine, what did I say? I think it was in the Bangor Daily News, that Maine saw the nation's largest drop of people without health insurance. Went from 8% to 5.7% over the last 3 years. That's really a testament to Maine taking the marketplace on itself and being aggressive, and also about Medicaid expansion. Both of those things together just knocked it out of the park, and really a stellar example of what's going on in the state of Maine. I think back when I was the ship liaison years ago, of all the New England states, and I say this sincerely, Maine certainly works together as a team, and all the parties, whether it's state or local organizations, the AAAs, the ships, and everyone else works together in unison to sort of make it a success. And that's really an awesome number, 5.7% over 3 years. So let's see if I can talk and move the slide. Look at that. So basically, we're going to go through, as I mentioned, turning 65, Medicare enrollment. We're going to talk a little bit about the Small Business Health Options Program, the SHOP program. Going to talk about the Medicare periodic data matching. If you don't know what that is, that's sort of our way of contacting people who are discovered to be eligible for Medicare, but we'll talk about that. Ways to connect with the marketplace. I'm gonna say it now that obviously that since Maine is running its own marketplace, that covermaine.gov is your place to go. You can always go to the marketplace for other issues and other information about assisters and navigators and various things. We'll go through some scenarios, some key points to remember, some resources. My favorite thing as a federal employee are acronyms. We just love our acronyms, and then we'll close it out. So it should help you by the time we get to the slide deck to identify considerations. If someone's enrolled in Marketplace, should be able to explain the program that can help people pay for Medicare. They'll know their options about the Small Business Health Options Program. We'll talk, as I just mentioned, a little bit about the periodic data matching, and then the resources. Excuse me, I think I'm going to pop another cough drop. Apologies again. Excuse me. This was actually a great week to be doing this. I'm glad I had the opportunity to talk and tell you about, if you haven't already seen it, the Medicare changes for 2023. Let me just move there we go. The standard monthly Part B premium is going to be $164.90. The annual deductible, $226. Insulin as of July 1st, cost sharing is capped at $35 a month, no deductibles. I'm so sorry. And ESRD, those individuals that are 36 months post kidney transplant can continue Part B coverage for a monthly premium. Those are all great things. And in a truly, it takes a village world, I just got an email from ACF, so I didn't even get it from CMS, that the Medicare Advantage and Part D prescription drug plan files are now loaded online, so you can actually go today and look at those. I haven't had the opportunity to do that, but that's a great thing to do. Excuse me. So some things to consider when people are deciding to enroll in Medicare Part B. First, as I mentioned at the start, we just announced the Part B premiums and the deductible. So those numbers were substantially lower. I guess the caveat should be noted is that they were substantially higher last year. It's the first time in a long time that they've gone down. So that's really great news, regardless of what things may have led to that. So, so sorry. So most people pay a monthly Part B premium, and it's usually deducted from their monthly Social Security or Railroad Retirement Board checks or federal retirement payments. The amount depends on income from 2 years ago and when someone enrolled in Part B. If they're not getting Social Security, Railroad Retirement benefits, there are 4 ways to pay for their premium. They can pay online through our secure Medicare account, and I hope you encourage people to set up accounts online. They can use their credit card or debit card. They can pay directly from their savings or checking account through their bank's online bill payment service, or they can sign up for Medicare Easy Pay. And you can get more information online at medicare.gov. And obviously people can still mail their payments to Medicare. Just make sure that they don't mail it to the JFK Federal Building. We do get those often, and not that stops them from getting enrolled, but it's just an incorrect stop in the process. So they should send it where it goes online. Excuse me. So one of the things that's important to know, although there's a number of things in this national training program slide that talks about individuals getting notice that they're eligible for Medicare coverage when they turn 65. I think that what's the dots say, that they may be eligible for Medicare and can change their health coverage. So if there's an individual and they're getting Social Security benefits, they do get a package from Social Security, the Medicare enrollment package. However, if they're turning 65 and they are not currently getting benefits, that they do not get a notice. They have to take an active enrollment, so they have to be engaged. And that's part of that redundancy that I mentioned earlier that I want to mention. So if someone doesn't take that action, late enrollment penalties stay around for the entire portion of a person's enrollment in Medicare, and they're not something to take lightly. They're not easy to remove, and the process to remove them is fairly strict. Social Security takes care of that. So there's different ways to sign up for Medicare late enrollments, and they should know that people need to cancel their marketplace plan when they sign up for Medicare. So most people pay a Part A premium. And you all know that that their enrollment entitlement period is 4 months before they turn 65. and they won't automatically be enrolled in Medicare unless they're already getting Social Security or railroad retirement benefits. They may qualify for Medicare based on a disability. Sorry, I'm trying to speed this up a little bit. Apologize for the rush. They may get qualify for Medicare based on a disability, and they must be entitled to Social Security disability benefits for 24 months. On the 25th month, they're automatically signed up for Part A and Part B. And finally, if you have ALS, amyotrophic lateral sclerosis, also called Lou Gehrig's disease, there's no waiting period. I think I'm going to skip that. By the way, Part A is considered a qualifying health coverage. And just to, I'm not going to read the bullets to you, but it's important that I note again that someone is not eligible for marketplace premium tax credits and cost sharing when they become eligible for Medicare. So that other penalty is paying back those subsidies that someone gets. It's not something that anyone wants to do. Most people pay a Part B monthly premium. It's deducted from their Social Security check. We noted the amounts already. Excuse me. There we go. So I already mentioned, once again, I just want to say it again, enrollment is automatic for people who get Social Security benefits and railroad retirement benefits. And that's what they're going to get. Get ready for Medicare. If you haven't seen it, that's what it looks like. We've talked about that already. One of the things that's important to remember, I am so sorry. If you miss your initial enrollment period, your IEP, someone's going to have to wait until the Medicare's general enrollment period. Don't want to have that happen either. That's January 1st through March 31st every year. Coverage begins July 1st. So there's a large gap in time that'll take place if someone misses that IEP. If more than 12 months have passed since turning 65, that's that lifetime late penalty. I'll probably say that 2 or 3 more times. That's something to make every effort to have someone avoid paying. And then effective January 1st, 2023, people who enrolled in Medicare Part B during the last months of their IEP or during their GEP, the general enrollment period, will have coverage starting the month after enrollment. And obviously there's a number of different SEPs of life changes. So people may be eligible for a Medicare special enrollment period. Once someone's Part A coverage starts, it's important to consider, as I think it was already said, that marketplace coverage duplicates the coverage you get from Medicare. You no longer qualify for those advance payments of the premium tax credits or other cost savings that you might be getting from the marketplace, and you have to pay the full price for your marketplace plan. So I can't think of any. I'm sure one of the experts from Kate can talk about what might be a scenario to keep your marketplace or Medicare. I don't know of any. Medicare doesn't coordinate benefits with the marketplace plan. It doesn't work as a Medigap coverage or secondary coverage. So there's really no benefit to doing that. So it's important to people be proactive and take that action when they become eligible for Medicare. And as noted in the last bullet there, at the end of the plan year, the federal marketplace may end your marketplace coverage if it duplicates with Medicare coverage. And I would assume that that Maine does the same thing, but I can't speak directly to that. Excuse me. Gosh, that must be irritating to hear someone cough on a presentation. So sorry. Okay, so here's some of the situations when you can keep your marketplace plan with premium tax credits. If you're eligible for Medicare, but haven't enrolled because you pay a premium for Part A. So there are people that buy into Part A. They didn't work enough quarters to qualify, and they pay their premium for Part A. They have a medical condition that qualifies them for Medicare, like ESRD, but they haven't applied for Medicare coverage, or they're in the 24-month disability waiting period. So if you're enrolled in Medicare and you're paying a premium for Part A, or if you only have Part B, you would have to pay a premium for Part A. Marketplace plans cannot pay claims that would be covered by Part B. So if they're eligible for Part B but didn't sign up, if you didn't delay signing up for Medicare and decided to sign up later, they'll need a sign up during that general enrollment period or SEP if they qualified for one. And then they're going to be responsible, once again, beating a dead horse here, for that lifetime Medicare Part B late enrollment penalty. And if your Medicare is ended retroactively, once again, you'll have to pay those claims that Medicare paid during that time. And if you think that's not possible, I can tell you from the accountants that work in our office, they are quite capable of doing their due diligence to work with the states to get those funds back. So it's not something we want to have anyone incur. So check your knowledge, lesson 1. If you delay signing up for Medicare and decide to sign up later, you can sign up at any time with no penalty. And I'm not going to call you out to have to answer this on a webinar. At any time with no penalty, during certain times with no penalty, during certain times if you qualify but may have a late enrollment penalty, or maybe it's none of the above. And C is the answer: during certain times if you qualify but may have an late enrollment penalty. So I'm going to take a minute or a couple of minutes to talk about the Small Business Health Options Program and Medicare. And I'm not familiar with how it works in Maine. I'm guessing it's not a very robust program in the state, but I can't speak directly to that. So I'm going to be speaking more generically about the SHOP program.
You're correct, Joe. It's not a very robust plan here in Maine.
Okay. I tried to do a little research on the front end, but I didn't see anything. So that led me to believe that as well. And I think Helen had mentioned that too. So an individual can get health coverage from an employer through the SHOP based on their or their spouse's current employment. And by the way, I wanted to take my hat off, if I had a hat on, about people who sign up for marketplace coverage and having, I don't know who mentioned it, about having the younger of the two individuals sign up in their name. That's a great point. I hadn't actually heard that before, but that makes so much sense to do that. An individual can get health coverage from an employer, as I said, through their SHOP based on their or their spouse's current employment. To purchase SHOP insurance, businesses or nonprofit organizations have to have 1 to 50 employees. And SHOP plans are available through insurers, through agents, through brokers, but they're not available through healthcare.gov and I don't believe through Cover Maine. You can delay your Medicare Part B enrollment if you have SHOP, and coverage from an employer through SHOP is treated the same as coverage from an employer group health plan. So it's considered, gosh, I can't think of the term at the moment. It's considered a qualified insurance. So you don't pay any penalties if you have that. You may get health coverage from an employer through SHOP based on your or your spouse's current employment. If you delayed Part B, you'll have a special enrollment period to sign up for it without penalty, as I noted, if you meet the following conditions. Anytime you're still covered by a group health plan, a GHP, based on your or your spouse's current employment, and during the 8-month period that begins the month after the current employment ends or the SHOP coverage ends, whichever happens first. And if you don't sign up, that is, if you don't sign up during the SEP, you may have to pay a Part B late enrollment penalty. Goodness, can't say that enough. For as long as you have Part B, and you can only enroll during Medicare's general enrollment period, which occurs each year from January through March, with coverage beginning July 1st. Another knowledge check. You must also enroll in Medicare Part B if you have small business health options program coverage. True or false? I don't think that's too difficult. False, of course. Coverage from an employer through SHOP is treated the same as coverage from a group health insurance plan. So you can delay Part B enrollment, as I mentioned, if you have SHOP coverage. But important to remember, when SHOP coverage ends, individuals will have that special enrollment period to sign up for Part B without penalty. I think, as someone mentioned earlier, healthcare is just so complicated, whether we're talking about Medicare, whether we're talking about Marketplace, or whether it's an employer group health plan. Any type of healthcare takes an expert to help someone get through the process. I don't care how experienced they are. And so the point was well taken by me that if you're counseling someone who's eligible for Medicare, obviously the SHIP and the AAAs are a great source. And for people in the Marketplace, going to CAKE and the various navigators that are working across the state of Maine to provide services. It's just so essential to help people get coverage. Lesson 3 is about Medicare periodic data matching. And so that's the way that individuals can find out about their Medicare coverage in advance. So we're going to talk a little bit about what's a PDM, what's new for PDMs, and what the PDM process looks like. So the Medicare periodic data matching is a process that identifies whether someone's enrolled in Medicare Part A, that's hospital insurance, or a Medicare Advantage plan and the Marketplace coverage by matching enrollment data. They're not notified by the Marketplace if they're getting a premium tax credits and our cost sharing reductions and have Medicare or the Marketplace plan. And if they've been found eligible for or signed up for Medicare, they're generally not eligible to receive financial help to pay for Marketplace plan premiums or for covered services. So we've mentioned that multiple times, myself and other presenters. They need to follow the instructions listed on their Medicare PDM notice. And the Medicare PDM notice, and you can go online on CMS and actually see what they look like. The Medicare PDM notice includes their name, a recommendation that they should end their Marketplace coverage, instructions on how to end Marketplace coverage or Marketplace financial help if they're signed up for Medicare Part A or Medicare Advantage, and the date that they must reply to the notice before the Marketplace takes action on their behalf. It also tells them where to find contact information to confirm if they're enrolled or if they have any questions about Medicare. And as I noted, you can go to marketplace.cms.gov, and the forms are all loaded there. I checked that out this morning to make sure that they were there, and they are. The Marketplace will end premium tax credits and or cost sharing reductions for them if they're enrolled in both Medicare and the Marketplace. So that's a kicker, right? That's one of the reasons that people can have expanded coverage and they can actually afford the Marketplace. So those cost sharing, those premium tax credits go away. And a statement was added to the application to act on their behalf to end the coverage. So it tells them what to do on that notice. It states that if anyone on their application enrolls in coverage through a Marketplace plan, but is later found to have other qualifying health coverage, including Medicare, Medicaid, or CHIP. So CHIP is the Children's Health Insurance Program. They have an option to allow the Marketplace to end their Marketplace coverage. And there it is on the slide. If someone has both Medicare and the Marketplace plan, they'll have 30 days from the date on the notice to return to the Marketplace to either end any premium tax credits or cost sharing reductions, or end their Marketplace plan if they choose to do so. They'll get in specific instructions in that PDM notice based on their Medicare enrollment status. They'll also have the option to disagree with the results of the PDM if they think they're not enrolled in Medicare, or if they return their application and resubmit it within an attestation that they didn't have Medicare. After the 90-day window, the marketplace will then take action to end premium tax credits or marketplace coverage depending on their preference. They can change their response from agree to disagree if they no longer want the marketplace to end their coverage, and they can take back permission for the marketplace to end coverage, and the marketplace will end premium tax credits and cost sharing reductions after 30 days goes by. So really the takeaway is that there's a lot of actions that need to be taken by a Medicare beneficiary or someone who's going to be eligible for Medicare. Those are actions, a positive enrollment or a positive disenrollment, I guess, from the marketplace that they need to take. Knowledge check: if you have marketplace plan, you're eligible for premium tax credits, cost sharing reductions, even if you also have Medicare. Well, I think you all know the answer to that. Of course, that's false. I decided to leave this slide in here. So this is the slide from the CMS Health Insurance Marketplace page. Excuse me. So it's important to know that there are things that are located here that might be helpful to you. You can go and look at them. That's the official information source for assisters and navigators and certified application counselors and other partners for information. You can get up-to-date information to help you counsel people who may benefit from the health insurance marketplace. And then, as was previously noted, that's what the CAIC folks are waiting to assist folks with. So I'm sure you all know this already. There's all sorts of resources available at no cost. And that's one of the great things about the SHIP program, about the navigators, about assisters. I mean, you all know, it's really quite satisfying to see the work that you all do in helping people. We know how complicated it is, how much time it takes, and how much effort it takes for you all to be knowledgeable about the program to help those people, whether they're enrolling in the marketplace plan, and CAIC's folks are doing that, understanding all the factors for them to participate in. I'm just going to skip that because many of you are SHIP counselors. So we're going to go through a couple of scenarios here, marketplace scenarios. And I decided, oddly enough, that the scenario is referring to Ms. Stone. I was going to change that, but I thought, obviously Stone is a generic name, so we'll let that go. Do I need to drop my marketplace plan now that I'm eligible for Medicare? I don't think I've said it enough, right? So information about Mrs. Stone: she's turning 65 next month. Her full retirement age for Social Security is 66 in 6 months. She was married for 15 years. Her former spouse worked for over 40 years. She has a marketplace plan, and she qualified for a premium tax credit and cost sharing. Okay, must Ms. Stone drop her marketplace plan since she's eligible for Medicare? Yes, she must drop her marketplace plan. No, she can keep her marketplace plan. And we all know no, she can keep her marketplace plan. Scenario answer to question: must Mrs. Stone drop her marketplace plan since she's goodness, that's redundant. No, but she should consider enroll. Right, okay. I'm sorry, I haven't seen that particular slide before. So really everyone is somewhat unique. The overriding, the umbrella statement is that someone should definitely consider enrolling in Medicare and ending their marketplace plan when Medicare is effective. There aren't too many scenarios where that's not the case. And as I mentioned before, there's no coordination of benefits between marketplace plans and Medicare. Medicare, as always, will be her primary payer, and the marketplace will end her tax credit. She may get a notice that her plan will be terminated. So when should Ms. Stone enroll in Medicare? Now, when she turns 65 next month? She shouldn't enroll at all, or none of the above? Now. When should Ms. Stone enroll in Medicare? She can consider rolling now. She's in her IEP, which is her first opportunity to sign up for Medicare. We talked about that a little bit before, and I'm sure you're all aware of that. If she enrolls during her IEP, she won't have to worry about late enrollment penalties. And what should she consider if she enrolls in Medicare? Medigap insurance, Medicare savings programs. So just a note about Medicare savings programs, it's such a small number of people, giving those that are possibly eligible that enroll in Medicare savings programs. It's really an important thing to help clients with. What does Ms. Stone need to know about her marketplace plan once her Medicare begins? A, that they'll coordinate if she keeps both. It will automatically terminate once her Medicare starts. The cost of her marketplace plan will increase once Medicare starts, or all of the above. The cost of her marketplace plan will increase, obviously, once Medicare starts, right? She loses those subsidies. What does Ms. Stone need to know about her marketplace plan once her Medicare begins? She'll need to return to the marketplace to notify them and ensure that her tax credits have been terminated. That's so important, so important. The cost of her marketplace plan will increase once she gets Medicare, and she'll have to pay the full monthly premium for her marketplace plan and full out-of-pocket costs when she gets services. There aren't too many plans where that's an affordable option. How would Ms. Stone's situation be affected if she never married? All of the above. The number of work credits she has, Social Security would determine she have to pay a premium for Part A. The premium for Part A, if you haven't seen lately, is pretty high, and she might find it more affordable to keep her marketplace plan and not enroll in Medicare. And since Ms. Stone didn't work enough in her lifetime to get Social Security benefits if she never married, she might have to pay a premium for Part A, excuse me. Key points to remember. These are obvious things, right? Medicare isn't part of the marketplace. Most of the time, it's best to have Medicare. If you have a premium-free Part A and keep your marketplace plan, you have to pay full price for your marketplace plan premiums. And as we mentioned, a person may have to return those premium tax credits, and they may have to pay all or some of those premium tax credits that we paid on their behalf for months. I think you all know that if you don't enroll in Part A and you had to buy it in Medicare Part B during your initial enrollment period, you may have to late enrollment penalties. Goodness, the one reason that we're talking about late enrollment penalties, that they're really a catastrophic sort of action that carries with you throughout the remainder of your life and your enrollment in Medicare. It's just something we can't tell people enough. I'm sure you've heard those stories from people that have that penalty. I know I have. And there's never a good answer about what to do about that. Some resources. So there's always cms.gov. You all know that you can all call 24/7 1-800-Medicare. Obviously the shiphelp.org site. The health insurance marketplace. So in Maine, covermaine.gov. And you can all still go to healthcare.gov, marketplace, cms.gov. And if you haven't ever been to medicaid.gov, I must say, as a longtime CMS employee, this is one of the great things that we've added, I believe 2 years ago. It's really quite a resource for me. I hope you take advantage of it. Not to complicate the information that you already know, but there's a vast realm of information about the Medicaid programs and how it works. And you certainly can avail yourself of that information. And certainly for kids, for the CHIP program, Insure Kids Now, and obviously so SSA.gov. If you haven't gone to our publications page, one of the publications that they're about Medicare and the health insurance marketplace, 11694, really pretty helpful. It's a fact sheet. I left that in there because really that publication site is really quite grand for getting information. You can order product there. Some publications only have a maximum of 4, and some you can order quite a number of them. The fact sheets, I won't read them all there. You can go there. And the National Training Program is really a fabulous resource. I went there this morning to see what types of links were there, and it's really a robust collection of all the trainings that they've done recently and historically. My favorite page, the acronyms. If you only saw the list of acronyms that we have to deal with, oh my goodness, at 24 years working for CMS, there are so many acronyms that I still seem to be unable to capture and remember, whether it's SLIMBs, specified low-income Medicare beneficiaries, the easy ones, obviously, like SSA, like Social Security Administration, and all the things here, periodic data matching, etc. And we're at the Q&A. I'm happy to try to field any questions if you have them.
Thank you very much, Joe. And for people, I don't know whether you've been able to, for attendees, if you've been able to look through the chat, but Helen from Consumers for Affordable Healthcare has added some information about coverme.gov and about the shop information that's available there. And I do want to stress, Joe is our Medicare expert and CMS connector, and CAKE and Western Maine Community Action and Maine Primary Care Association are our major contacts for the marketplace and assistance for people under the age of 65. And the Medicare savings programs, as Joe has mentioned, there are many more people who are eligible for those programs in Maine than ever apply for them. So I know it's an important piece of your outreach, and I do encourage you to continue with that. That said, are there any questions that people would like to raise while we have our experts right in front of us?
And if I could add one thing, so thank you, Helen, for adding that link to the Medicare savings programs. I believe we did a pilot, and it wasn't in our pilot in New England was in Manchester, New Hampshire, to try to target individuals in that area. And from that demonstration that we did, I believe that there's going to be a workbook of information of consumer materials for the Medicare savings program that you can order from the publication page. And I apologize for not looking that up prior to today, but I'll get that to Ann later.
Great, thank you. And I do think, I know the AAAs work diligently at, their benefits outreach and application assistance with that. So thank you all. Are there other questions while we've got our pros here? So be aware you will be getting all of these slide decks in your emails. I apologize for beginning a little awkwardly, but that was through no fault of anyone's. I don't know what's going on, but there have been technical problems. And I think we should be looking forward to a successful open enrollment period. I think hold on to your hats. I know all of you are going to be very, very busy. And then we have open enrollment for the marketplace as well. And there will be a lot of collision of needs there, because there will be people who are aging into Medicare, who have families that need to remain in the marketplace. So please take advantage of the wonderful resources we have and make your referrals, because you probably will be getting referrals from them as well. Thank you all very much.